Well, we saw diverticulums or diverticula of the colon. We know that there is a Meckel's diverticula or outpouching of the small bowel. So why can't we have a diverticulum of the esophagus as well? Actually, we can. And this is a diverticulum of the esophagus. Notice you could see a non-keratinized stratified squamous mucosa, a lot of nice smooth muscle underneath. And in this area, approximately in the area of ulceration and inflammation, from here to about here, there appears to be kind of an outpocketing of the esophagus. And in this outpocketed area, you see several things. First of all, in this particular case, there's some ulceration of the mucosa. One of the more important features, however, is do you notice how the smooth muscle kind of disappears in the area of the diverticulum, and the smooth muscle that you see along here kind of disappears as well. So in this area, there's not much smooth muscle, and that makes you think that perhaps this diverticulum was due to traction, pressure forces that caused it to pouch out, rather than something that would be congenital, because in a congenital diverticulum, you would probably see an intact lining of smooth muscle around it. Should we go a little bit closer? Sure, why not? I don't know why, because we've already seen all the main diagnostic features, but in this slice, I hope very soon, you could see a non-keratinized stratified squamous mucosa. You could see that it's kind of coming in to here. You could see in this area it's absent. You could see this is the area where it stops. And you could see a lot of organizing inflammation in the area of ulceration. And you could see either small remnants or almost absence of the smooth muscle bands that you see here and here and here, and maybe just a little bit out here. Maybe there's a few little ones out there, but for the most part, that smooth muscle is gone. The general principle is if a esophageal diverticulum has smooth muscle, it's congenital. If the smooth muscle is gone, it's acquired. This is a Zenkers diverticulum. It occurs in older people, so it's not congenital. It usually occurs in one single area, and I can show you a nice little picture of it. It looks like this. It usually occurs posteriorly in the junction between the pharynx here and the esophagus here, and usually protrudes a little bit posteriorly, and it's an acquired thing. Usually people over 50, it doesn't turn into cancer, but as you could see, it could become inflamed, it could become ulcerated. I guess it could perforate, but unfortunately I don't have that much knowledge about these kind of things. But you could look this up in Wiki or Google, and in 2 seconds you'll know 10 times more than I do. Thank you very much.